Day 2 is all about communication. We start looking at communication do's and don'ts. What things should we do? What does effective communication look like, sound like, feel like? And also maybe some of the things that not poor communication or not effective communication. Then the other things we need to start looking at is using patients' words to try and help them make sense of their experience. So rather than us as clinicians starting to say to patients, let me tell you all about your pain, maybe starting to get patients to engage more with communication, to elicit their story, their narrative more. Then we start to look at psychology, which I think is really important. So that means looking at things like motivational interviewing, finding out somebody's desire. Also looking at things like cognitive behavioral therapy, linking their thoughts to their behaviours and how those things interact together. Then we start to look at things like acceptance and commitment therapy. And then at the end of the day, we start to look more at case studies. So all the way through the course, we divide people into groups, and in those groups you start to look at real patients, their stories, their narrative written by patients, my patients. And then what I start to ask you to do at the end is to show me, what have you learned in this course? How are you going to use your learning, your skills, your tools with real patients? So you get to practice what you've learned in the course before you leave with some colleagues. So then you feel confident to try these things yourself.
Oli kyllä yksi käytännönläheisimmistä kursseista, joilla on ollut.
Todella hyvä. Ei kyllä oikein mitään negatiivista en keksi. Tärkeitä asioita, tärkeitä tietoa, laadukas materiaalia ja selkeä ulosanti kouluttajalle. En keksi mitään huonoa sanoa.